What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. I am your host, Dr. Meghna Dassani. Today, I am excited to introduce a colleague who I can't say I have the pleasure of having known, but I'm hoping this is the start of a unending friendship and relationship just because we share the same passions. She lives on the other side of the country. I have followed her avidly on Instagram, so we'll share everything, all of her info details, the gist. It's going to happen in the show notes. But I have the pleasure of introducing you guys to Dr. Tiffany Lamberton. Welcome.
Thank you so much for having me on the show. This is such an honor. When you reached out on Instagram, I was like, yay.
I know. I was like, oh my gosh, please tell me she has time to do this. So there's so much exciting stuff that I want to share about you. We're going to jump right in. You are a dentist, right? Trained as a dentist. Dare I say you're a practicing dentist as well, just not general dentistry, but you trained in physical therapy as well, correct?
Correct. Yes.
And
So
how did that marriage happen? Tell me all about it.
I know. So I went to physical therapy when I was young. I was really interested in, I was always very athletic, and I was interested in biomechanics of the body and the movement. So I went to physical therapy, graduated with a master's degree, practiced as a physical therapist, both in California and Washington, working with a lot of sports injuries, orthopedic things, loved my job. And then I met my husband. And he ended up getting into medical school in Southern California at Loma Linda. And so we got married, and I ended up moving back down. And I just kind of went through a career crisis. And I was looking around, and I was like, I think I want to go to dental school. And my dad was a dentist, and everyone said, what? You're crazy. You're already a PT. Why do you want to do this? But I just was determined to do that. And it was kind of fun because I was actually able to work part-time as a PT and teach Pilates while I was going through dental school. What I found as I was going through dental school, that as dentists, we get so focused on the teeth and the bite that we forget to kind of look at that bigger picture of, kind of beyond with, the musculoskeletal system, maybe the spine, breathing, all of those things. And so after dental school, I was doing some continuing education. And I was like, why isn't anyone kind of bringing together things about the temporomandibular joints, airway? We need to have this kind of bigger picture. And, I think as general dentists, we tend to practice by ourselves. We tend to be a little bit siloed in our thought process. And I just started to get really passionate about looking at TMJ. Why do we not have more education as dentists, first of all? And second of all, especially when it comes to kids and airway, this is turning into a long answer, sorry, but also like as a mom, I started to see in my own kiddos some of these things as I'm exploring these different pathways, and going through myofunctional therapy training, going through airway training. So a lot of my thought process was influenced by the postgraduate continuing education that I did. But what I decided, is I want to bring all of these things together. So I have a little graphic that's a triangle where it's like airway, myo, and TMJ, because I do think that sometimes the TM joints get sort of forgotten unless they develop a problem. But with the exciting changes in the paradigm shifting of where we're becoming more airway centric, airway aware with both our pediatric and our adult patients, I think that the dialogue has changed as practitioners. And so I'm very passionate about collaborating with other dentists, other dental specialists, other medical professionals, let's say maybe an ear, nose, and throat physician or a sleep physician. And like I said, just really trying to work together as an interdisciplinary team for the benefit of our patients.
I agree with you. It's a very exciting time in dentistry. We have all of these, they're not really forgotten. We just never pay too much attention to it, to the airway, to the TMD, to TMJ, all of these disorders. And now that it's coming to the forefront and even more exciting with kids. So let's jump into, and I know, so is your practice solely focused on airway and TMD and such, or do you pick up a handpiece even?
About 2 years ago, I decided I was going to, I am a general dentist, but I decided to limit the scope of my practice to just TMJ disorders or TMD and airway. But I would say, so I have a small kind of niche practice. It's fee for service in kind of the Seattle Tacoma area of Washington State. And, the issue is that I have a lot of adult patients that have already gone down a pathway where they're having now a lot of pain and dysfunction. And so what I would like to do, and I'm really working on my, pediatric dentists and my orthodontists in the area, is to, can we kind of like rewind the clock on some of our patients? Can we look back at those younger patients, maybe that 10-year-old female patient or that 12-year-old patient before, she's gone into kind of, maybe traditional orthodontics and maybe just manage it in a little bit different way to try to kind of prevent this cascade of pain. Because when we talk about TMJ dysfunction, we start describing symptoms a lot of times, like maybe headaches or limited jaw, opening or closing, or maybe pain when you're chewing, or maybe noises or popping with the joints. But I think as dentists, we kind of tend to forget about the joints unless there's like a problem with it. And so what I've found is I get more excited about working with a younger population. So that part of it is developing. And then the other piece of it was I became very passionate about education. And so TMD Collective was born to kind of guide, educate, and create community for other healthcare providers, other dentists, other, healthcare workers like speech language pathologists, PTs, OTs. Like I said, we kind of get a little siloed into our practice, but when we can learn from each other, I think that makes us stronger. So TMD Collective, is also kind of an educational platform. So I have a few courses that are kind of geared more towards physical therapists, myofunctional therapists, some general dentists, to try to get general dentists more excited about airway and the spine. But then I also have a podcast that's called Jaw Talk with Dr. Tiffany, which this is like so lovely to be able to collaborate with you, because I talk all about airway, myo, the musculoskeletal system, TM joints, and, bring in, just like you do, really experts in different areas. So I've had Dr. Jeff Rouse on the show. Dr. Jim McKee is a mentor of mine. He's Spear faculty. He's been a huge influence. So Dr. Drew McDonald is an orthodontist that I've collaborated with on some cases. So I really feel like I've built on the shoulders of, some amazing providers that I've learned from so much. And I love collaborating with other women in dentistry. I think that we get along a little bit better, right? We're not so territorial because, I just think we can learn so much from every interaction that we have.
Absolutely. There's so much that we can pick up from each other. Let's jump into a lot of these clinical things that sometimes, as dentists, as providers, or even as patients, because, our show is geared towards our patients. How or what should we be looking for? Or how would you recognize that patient that is at a higher risk for TMJ or even airway conditions based on their posture, for example? That's your wheelhouse right there. Or even their occlusion when we're evaluating that. How would we go about, what are the telltale signs there?
Yeah, that's a great question. So I think especially in those young kiddos, as we're looking at, as dentists, we kind of tend to look at how the upper and the lower teeth fit together. And then I think when we start to see what we call a retrognathic mandible, or like, some people call it like a weak chin, or you're looking at someone from a side profile. And you can tell that, especially in a growing child, that maybe things aren't growing to kind of their full potential. And As a dentist, we call that like a class 2 patient, or we call it an anterior open bite, which means that sometimes when you bite on the back teeth, the front teeth don't couple together. There's this kind of opening. And so to me, when you start to see some bite changes like that, especially in the growing child, and any noises in the joints, my opinion is kids shouldn't click with their jaw joints, and they shouldn't snore. I think those are some signs that maybe we need to dig a little deeper. And I think when you're watching the pathway of the jaw as they're opening and closing, as a parent, you can watch your kiddo, as they're chewing and eating. Does their jaw do kind of like a little, S shape, or does it kind of like go to the side and they open their mouth? That can also be like a little clue that there might be something going on under the surface with the skeleton that might be influencing that. And then an asymmetry in the face as well. So I think sometimes if you see a chin that's shifted off to one side, that could be a sign that maybe one side, that shorter side, maybe isn't growing as much with the mandibular projection or the lower jaw projection. And that could also be, like a little red flag to maybe we need to work together with some of our other providers to maybe look at some more modern imaging, and see if there's something going on with like I said, the underlying skeleton that could be contributing. So, we have the benefit of some amazing technology where we have, digital scans of the bites in our kiddos. We have what's called a cone beam CT scan, where we can look at the airway and the joints, and as well as the teeth. Sometimes utilizing something like an MRI of the TM joints in these high risk patients can give us really some clues and a lot of good information. What the MRI is going to do is give us an indication if the soft tissue is healthy. So that's going to tell us if the little disc, that's like the cushioning or the little gasket in between the bone of the lower jawbone and the joint socket, is it protecting and in its right place? And also, some of the MRI sequences are going to give us an indication is if there's any edema or swelling in the bone of the condyle. So what we're seeing sometimes is that not all kiddos have healthy joints. And so if we're thinking about maybe different types of orthodontic treatment, whether it's an appliance or even surgical things, I think we need to slow down sometimes and really get our diagnosis and put together what we know as dentists with our muscle palpation. You mentioned posture. Sometimes you'll see a very forward head. Sometimes you'll see one set of the neck muscles that's more prominent than the other side, or you'll see discrepancies in the size of where their shoulders are. And so all of those things, the soft tissue is going to kind of follow the skeleton, and we want to know what's going on with both the skeletal tissue and the soft tissue.
That's great. That is amazing. So it sounds like, and of course, you and I both know this, but it takes a tribe, right? It takes a village to treat these patients. I wish we could have had like a magic wand that we could wave and address everything for our patients. How can we as providers work as a true interdisciplinary team, be it with myofunctional therapists, be it with OTs, be it with PTs, be it with whoever that may be or look like, even our sleep MDs or sleep specialists, or other dentists. What have you found is the easiest and the best way for us to work together collaboratively?
Yeah, I feel like the general dentist is honestly so perfectly positioned to be the leader of the team, because we're already seeing them in the practice, right? Every 6 months, and you've got your hygienist. And if your hygienist is interested in myofunctional therapy, I've found that they are such a great resource to do, for me to train, or pay even my hygienist, if they're excited about it, to do some of the courses to become a myofunctional therapist. I think that's a wonderful adjunct that you can have in your office, or, even thinking about a body worker either in your community or that you've brought in as an employee, to do do some of the myofascial work, or some of the body systems that as dentists we're not as comfortable with without that background. So I think you have to kind of hone in on what type of practice you want to have. Do you want to have the babies, because for me, I'm not doing any babies, but, like I had Dr. Annie Babb on my show, she's doing a lot of infant tie release and working with lactation consultants. And so that's a very niche practice in it of itself. And again, I think as an adult, they're going to already have, dysfunction in the system, and it's going to be harder, and it may involve more surgical procedures to try to correct some of those sleep deficiencies, or, skeletal deficiencies where you're having to bring in an oral surgeon or, maybe a periodontist or, depending if you're doing MARPE or, not to get too like technical, but if you're trying to, expand the airway space, as an adult, it's going to be harder. Whereas a child is going to be kind of more like putty, right? Like silly putty. You can kind of mold things a little bit better. So I think really, and you mentioned how you've created a community around you. And I think that's what social media can do. I have patients or prospective patients will message me and say like, who do you know in New York? Or like, do you know someone in California? And so the more that we band together and, then we can provide that as a resource to both prospective patients as well as other providers. Like, hey, your philosophy is really similar to mine. Who have you found in your area that you trust and like? So for me, in my little area of Seattle, Tacoma, I try to spend a little bit of time every week networking with my community, whether that's like taking business cards to the offices, bringing them lunch. I try to stay involved with organized dentistry. So like I sit on the board of our local dental society. This month I'll be lecturing for our meeting. So just trying to kind of create, value for what I do so that the patients, when they find me, they're like, oh, Dr. Tiffany, like, Dr. So-and-so told me about you. And they said, I have to see you, so kind of like creating that value for like what you do. But like I said, I think the general dentist should be the one like leading the discussion. And with my orthodontist, what I want to do is I want to give them all my information that I've gathered on like a little silver platter. Like, here's where I want the teeth to be, and here's where I want this. Now, how can we accomplish this? So I don't know how much you're doing in your practice with early appliances, but I think that more and more dentists are getting excited about the all of those things, whether it be MyoBrace or Healthy Start or Tooth Pillow, and you probably know more about all of that than I do because I'm kind of like picking up the pieces on the adult patient that maybe has had, like I said, pain and dysfunction later on, so like I said, if we can rewind the clock and find those providers that are like,
Right.
yes, let's get them when they're at that Play-Doh stage.
Yeah, no, I'm with you on that. It's, I always tell docs this, like the general dentist is the quarterback in this. We don't always have the means or the tools or the answers as to what needs to happen, but we more than likely know what needs to happen first. So a patient may be in my practice and may last. They may have to see the ENT first or the myofunctional therapy first or whoever that may look like. And I'm probably fifth or sixth in line, but it's never about us, right? It's about what is right for this patient, for what's going on with their sleep, their airway, their joint, so we can get them to where they need to be. So I love it. I love that, you're doing all of this to support not just your patients, but your specialists as well. I'm a general dentist. I still, unfortunately or fortunately, love teeth. So I still practice. Yeah, a huge portion of my practice is sleep and airway, but I can't seem to give up getting people out of pain and treating teeth. You mentioned you have a lecture coming up. Tell me what's coming up in 2024. What are you excited about? What's What should
Yeah.
we look forward to hearing about?
Yes. So I'll be lecturing the end of February to the Pierce County Dental Society, which is our general membership meeting for. So if you know a little bit about organized dentistry, it's a tripartite system. Like the ADA is the overarching umbrella. Then each state has their own dental association, and then they divided up into like a local component dental society. So I'll be doing a lecture that's called Beyond the Bite. A physical therapist perspective on temporomandibular joint disorders or jaw joint disorders. So that'll be coming up the end of this month. And then I'll also be lecturing later in the year to a big group of orthodontists down in California. So I'm really excited and nervous, but just, wanting to share my passion to the world. And then, like I said, if you want, check out my podcast, Jaw Talk with Dr. Tiffany. We've had some really fun episodes. Like I said, I've had a speech language pathologist on, I've had a PT, I've had an oral surgeon that I went to dental school with. So it's just, like I said, it's a little bit more technical and maybe geared more towards healthcare professionals. But, I love podcasts because like I can listen to it while I'm walking my dog or like working in the yard. And I think, we're finding, modern education is like, we need some of those like quick sound bites of information. So those little like gems that like kind of help us with, overcoming some of the problems or things that we see in our practice. So.
Absolutely. While we're on this topic, where can our listeners find you? If you wouldn't mind, like I mentioned earlier, her Instagram's fabulous. You guys go follow her, but share your website or your social media links. Where can people find you?
Sure. So I'm probably the most active if you want to engage with me on Instagram. So it's tmd.collective. I also have a personal account, Dr. Tiffany Lamberton, if you want to see more pictures of my adorable puppy Wookie and, more about my hobbies. I'm obsessed with Pilates and wake surfing and snowboarding and travel. And so I'm most active on that platform. I'm also in LinkedIn and Pinterest and YouTube. But yeah, my main website, if you wanted to check that out, it's tmdcollective.com. I do have online scheduling for patients. If you want to see me as a patient, there's a way to book an appointment. There's also courses for other healthcare providers if you're interested in, just hearing a little bit more of my philosophy. So that's through the main website, tmdcollective.com.
Perfect. That is beautiful. We will have all of this information in the show notes, so you guys don't need to worry about scribbling stuff down. We'll have all the links to her social media, her website, and just any information that we have for her. Before we leave, and as we wind up, what are your top 3 tips for our listeners when it comes to airway, TMD, anything at all? What are the top 3 tips?
All right. Well, I would say first and foremost, really find your people that believe in evidence-based dentistry. There's a lot, unfortunately, of misinformation on the internet where, people are selling things or, maybe they're touting their, supplement code. Really look for the people that are the experts. We may not be the loudest voices with like 5 million followers, but they're, our training and our background in evidence-based dentistry is so important to really, work with you and give you the most up-to-date information. So don't be fooled by celebrities. And then I would say also be relentless with advocacy for your kiddo. It may take going to different providers. You may hear some different information, but if you're noticing some of those signs and symptoms that your kiddo may have a sleep-related breathing disorder, maybe they're breathing through their mouth, or you're seeing that they're grinding their teeth or wearing their teeth down, maybe they're wetting the bed, or their sleep is not restful, maybe they have dark circles under their eyes. pay attention to, how is your child functioning? And if you don't get the right answer, don't be afraid to keep searching. I guess I would say as a mom, I'm like relentless. So be relentless, be bold, educate yourself with the right kind of information. And remember that like we're dealing with human biology. So every case is different and your child is unique. Every environment is different. But beware of, the quick fix of like the do-it-yourself aligners, or, we just saw a big company, Smile Direct Club, kind of take the fall, which I feel like as dentists, we've been saying for a long time, this isn't a good idea. So if it seems quick and easy that bonding your own teeth or putting on your own veneers, no, please leave it to the professionals.
That is amazing. Such great advice and tips. I want to thank you for taking time out of your Friday to come spend it with me and sharing all of this information. You guys go follow her, listen to the podcast. Lots to learn, lots of invaluable pearls that we can all pick up. And as always, share this episode with somebody that you know could benefit from learning about this. And I will see you next time.